Hello, my name is Michelle. Welcome back to another video. I'm a reflexologist and I like to make videos on reflexology and tell people can help themselves with reflexology. So in today's video, I'm going to talk about urinary tract infections, also known as UTIs. So UTIs are usually caused by bacteria entering your urethra, travelling to your bladder and causing an infection. Symptoms can vary from quite mild to quite serious. So UTIs may occur for many different reasons. Some of the more common reasons being poor hygiene, having too much sex, chemicals in body soaps and shower gels and bubble baths can cause irritation. Also, if you're pregnant, you're more susceptible to getting UTIs. Also, if you've recently had a catheter or some medications can cause urinary tract infections. Some of the symptoms of UTIs can range. So some of the more common ones include a burning or stinging feeling when you go for a wee. You may also find that your wee is more cloudy, smelly and dark. You may also find that you need to wee more often. This is because of the infection. It just feels like you need to wee more often, but then when you go, there isn't much there. You may also feel some pain in your lower abdominal area, in your tummy area, and you may also generally just feel a bit unwell along with these symptoms too. Usually mild symptoms of UTIs will go away within a few days. If they don't go away in a few days, make sure you go and see your doctor, as this may be turning into more of a serious UTI. If the infection travels to your kidneys, that's when it becomes more serious. So just make sure that after a few days, if your symptoms don't clear up, go and see a doctor. There are a few things you can do to help with the UTI. So I'm going to show you some reflexology points on your feet. But also alongside that, make sure you're drinking lots of water. You can also drink cranberry juice. Make sure that it's natural cranberry juice, not one with lots of added sugars in. Cranberry juice can just help clear out the infection quicker. You want to be avoiding having sex if you're sexually active, and also when you do need to go for a wee, make sure you go, don't hold it in, try and get rid of it as soon as you can. You can also buy cystitis relief sachets from the chemist. These are little sachets that you pour in water and can help reduce the acidity in your urine. So those are some of the ways that you can help flush out a UTI quicker. And remember, like I said, if it doesn't go away within a few days, please go and see your doctor. So as well as those few tips, I'm going to show you the reflexology points. So these are really effective when it comes to UTIs. I'm going to show you the bladder reflex, the ureter reflex and the kidney reflex. So working these is really good at helping to remove any toxins going on in those areas, clear out any stagnant kind of energy, and just help to kind of flush anything away. So I'm going to show you those points on the feet, and I will show you those now. So I'm going to start with my left foot. I'm just sat cross-legged on the floor, but any way really that you can just access this part of your foot, however you feel comfortable, that's perfect. So I'm going to start off with the bladder reflex, which is located around here. So if you look at the ball of your foot, the top of the ball of your foot is just here, and then the bladder is located around here. So if you push quite firmly, when you've got the right spot, you will feel it. So this feels really quite sore. So what you want to do is just be pressing in to that fairly firmly as much as you can. If you kind of just cover the whole of this area, if you're not sure if you've got it or not, then you will definitely get it. Then you want to be working your ureters. So these travel from your bladder up here to your kidney. And again, if you have a UTI or prone to having UTIs, this will feel quite sore. So you then want to be kind of working upwards to here. So if you do that for a little bit, a few strokes upwards, I can actually feel clickiness and kind of like crunchiness as I work up here. This just shows that it's quite congested. It can also be a sign of dehydration. And then your kidneys located in the middle, just around here. Again, that will be sore too. So if you work this reflex just like this, and then you can just go up and down. So bladder, ureter, kidney. Now you've worked those, you kind of almost want to do like a flushing motion. So you start where your kidney is and just kind of do that, ending up. So kidney, flush down to your bladder. Be quite mindful when you do this and almost imagine that the infection just clearing from your body. You can do this a few times a day when you have a UTI. Make sure you don't overdo it too much. You just want to kind of help just clear the infection along. So that is on that foot. And then I've got my right foot, so it's exactly the same as on the left foot, but I'm just going to show you again so you can follow along. You've got your bladder point here, so ball of foot, the top go along, and it's located around here. So if you just keep pressing until you feel quite a sharp pain, then that's where the bladder point is. So mine's just here, feels quite sore. So if you're doing this yourself, do it for around a minute. And then the ureters, which go up the inner foot, up to where you feel the kidney kind of bumpy area. So just kind of work that up like that. Again, with quite a firm pressure. You can also caterpillar your thumb up there. And you've got your kidney. So your kidney is just here. And then you just want to work that in a kind of circular motion. You can do this with some body cream or some oil, or you don't need anything at all. Now you've worked that, you want to flush. So start from your kidney, flush down, out your bladder. Kidney, down your ureters, out your bladder. And again, just imagine that this is flushing that infection out. And those are the reflex points on the feet. So that is all for my video today. If you have any questions at all, please let me know and I will get back to you. But I really hope you find these points helpful. Please let me know if they work for you, and also please subscribe to my channel and like my videos. I'll be very grateful. And I will see you in my next video. Thank you very much. Bye.